Hey guys, so I want to talk about what happens when your migraine prevention resources and therapy aren't working. So you've tried your medications, they're not working at home. You've tried the preventive strategies, you even seen your primary and you still have a migraine and you don't know what to do. Well, studies are showing and recommending that a lot of patients end up at the emergency room. And when you enter the emergency room or the hospital, the first line treatment is usually standard across the board for acute migraines. Doctor will see you, do a medical history. They'll want to rule out some other diagnoses such as a stroke or maybe even seizure, and they'll treat the migraine according to the symptoms. And the first line treatment that the doctor will usually prescribe to the nurse is put an IV in you to hydrate you, since migraines are typically associated with low blood volume or low fluid count, hypovolemia. So they'll want to get a liter of IV fluids and you hydrate you that way. The typical medications are standard across the board. They'll give you some IV NSAIDs such as Toradol, usually 30 milligrams IV push. They'll try 25 to 50 milligrams of IV Benadryl. That will help out with symptoms. Sometimes, depending on where the provider is or depending on the patient's symptoms, they may add something like a steroid such as Solumedrol intravenously, which can help prevent a rebound migraine from reoccurring within 72 hours. And then another medication that is sometimes seen as an IV push antiemetic, such as IV push Zofran, or one of the more popular ones is Reglan IV push. The reason patients come to the ER to help deal with these symptoms is because they're not tolerating PO or oral medications. They're getting worsening symptoms and they've exhausted all their resources. So these are when I would advise you to go to the emergency room if you've tried everything and nothing is working so far.